Today's Daily Health, we're focusing on male infertility. It's a condition that affects a man's ability to conceive with their female partner. And while we hear a lot about female infertility, research shows that about half of infertility cases stem from male partners. In fact, some studies find that male infertility affects up to 15% of U.S. men who are trying to start a family. Joining me now is Dr. Lucky Seekon. She's a double board-certified OBGYN and a reproductive endocrinologist and infertility specialist. Who better to talk to about all this? So what are some of the main causes of male infertility?
So it can be a sperm production problem, and that's often because of problems like a hormonal imbalance, genetic disorders. But then you can have issues where the sperm production is just fine, but it's more about the sperm delivery. There can be obstructions because of trauma, surgery, scar tissue because of prior infections.
Okay, and I see cancer treatments on the list too.
Definitely, there can be medical treatments that can make it impossible to make more sperm moving forward.
I think most of us are more familiar with female infertility. We hear about it more. We maybe know what the risk factors might be, but what about for men? What are the risk factors?
Well, there's a large list, right? And sometimes it's genetic causes that aren't modifiable. But there's a huge lifestyle component as well. We know that being overweight can lead to an over-predominance of estrogen, and that balance is then thrown out of whack, and that can reduce sperm production. Smoking is a big one, and that includes vaping, excess alcohol intake, right? And then, like you said, there can be medications that people are taking that indirectly can affect their fertility.
And age as well, over 40?
That's a common misconception. A lot of people think that the biological clock only really affects women. But we know that advanced paternal age is a very real thing. And so men in their late 40s and beyond can have lower sperm parameters, sperm quality can be affected. But more importantly, over time, they can accumulate mutations in their sperm DNA that can be passed to future generations.
What can men do to help reduce those risks? And what about diet? Does that come into play?
Diet is a huge factor. It's part of lifestyle, right? And we know that reducing the amount of processed foods, processed meats, red meat, adapting more close to a Mediterranean-style diet, right, that's high in antioxidants, these things can actually make a difference because men, unlike women who don't make new eggs, men are making new sperm all the time. Every 72 days, there's a regeneration of those sperm cells, so there's room for improvement.
Is there a test, I mean, I'm sure there is, a test for men where you can test fertility the way that they do for women?
It's actually quite simple and cheap. It's called the semen analysis, where we collect a sample and we look at it under the microscope, and it can tell us about sperm concentration, the percent of the sample that's moving in a forward direction, and the percent of the sample that is shaped normally and looks normal under the microscope.
And is that a common thing to ask for? Like, should we feel, men and their partners feel open about saying to a doctor, hey, maybe we should test the guy?
Absolutely. I think all too often it's delayed, and it's low-hanging fruit. It's such an easy test to have done. And as you mentioned earlier, half of cases of couples going through infertility have a male factor. So it can really delay timely diagnosis and treatment if you don't get that test done from the get-go.
Yeah, there is this perception that it's more like the women that are in charge of fertility, and it's just not the case.
No, it takes two.
Right? Exactly. It takes two to have children. So, all right, doctor, thank you so much. Really appreciate you being here. Dr. Lucky Seekon, good to be with you.